have an increase in the next few years as well. So why do we want to use new techniques in our field? Here are two examples of conventional methods. When we, on the left image, can see several people need to help us when we do guiding and to determine the guiding angles. And on the right side, we can see fluoroscopy machines, which provides us live radiographs, but they also causes scatter radiation, which is a big health issue. And if we want to reduce these things, we can use 3D instead, according to me. And without the 3D guiding system, we put in screws and pins blindly in most cases, and then we do it with safe margins. So, which in consequence then will lead to have us in less stable placement or fatality that we're going to talk about it a little more later. So we use mainly CT images and to create the models, and it allows us to create very precise models thanks to its high spatial resolution. But it's really crucial to have good protocols and to optimize them, to have better raw material to work with from the beginning. And it makes a huge difference, actually, if you have good or bad images. And my tip is to improve the basic settings before going into the fancy modalities to be sure about the basics and have good knowledge about them. And here we can see really good segmentation software. It's from Medviso, and it's called Segment 3D Print. And the images here on the top left side, it's the images are acquired in transverse view and then reconstructed into sagittal and coronal views. And then on this image on the top right corner, you can see with the threshold that we choose to segment bones, this software calculates where it should be. So this is used in every single slice, and then in all reconstructed images too. We get the segmentation to have our models. So that's the basic of creating models into the medical field from anatomical structures. And this is the first case that I did about 2 years ago. It was Harry. He came in with ataxia, kyphosis, lameness, and episodes of really severe pain. And on the CT images, I can just explain to you that you can see a misshapen T9 and T10 vertebrae, and then you can also see a compression to the spinal cord. So we wanted to take away the compression and to stabilize the spine in this region. So we did this with actually I can show you the video here of the dog that is walking with a stiff gait, and this was done hours prior to surgery, so on the same day. And then if we look at the model that we segmented out from this dog, and when we plan the surgery, we create safe corridors with so-called trajectory lines, and then use these lines to create jigs or tunnels that we do want to put the pins in. So these are the bones. So we print out both the bones and the guides here, as you can see on this part of the video. And both of them can be sterilized, and they are also fully compatible intraoperatively. So we can use both of them. As you can see on these images, they were from the same dog. We used these guides to drill in the pre-planned trajectory according to the pre-planned trajectory line. And these were CT images that we did after the surgery was completed, and you can see that the pins were put in a really good angle, and the exact same angle that we planned before. So they are neither penetrating the vertebral canal or they are not pointed outwards, which is really common to do to be on the safe side if we do it without 3D system. And this is a render picture of the bone cement that we put in place together with the pins here, and we use this image to the owners to see to explain how the surgery went or what we did with the as the result. So this was Harry during his physiotherapy sessions, and he, on the right side, you can see that he made really good recovery, and he was a happy dog. And owners still sends me mails and ask me if they have any restrictions for the dog. So he went out really well. This is another case, and it was Diva, which suffered from a C1, C2 instability, where the second vertebrae were unstable and subluxated from the C1. So we wanted to stabilize them to each other, and we used and in this case it was so evident that this technique is really good for small patients or for small structures, because we plan to put in 0.9 millimeters pins, and then it's really precise when we put them in. And as you can see on this right image, the surgeon can barely fit his fingertip inside the wound. And if we put just the guides, they're so small, so you will be able to see the structures around. So it's easier for a surgeon to not have things in place here. And this is the post-op CT that we did and segmented it. So this is the actual placement of the pins that we had on this patient. And she also recovered. She was an 8-month-old dog, so she had the puppy-like behavior just a short time after. So, and we also do quite a lot of bone deformities. This is a dog with, as you can see in this picture, it's a dog with pes varus. It's a disease where the dog gets, it's a bone deformity of this dog, as you can see. And we plan how to perform the surgery, computer-aided, and then we create osteotomy guides and use, and then when we cut where we want it to be cut and reduce it to straight bone, then we use the T-plate, but any kind of supply that you want to use. In this case, we had a T-plate, and then we use the T-plate as the reduction guide. So we can plan it with all the supply that we're going to use during the actual surgery. And this is the dog 4 weeks after the surgery. I don't know, we're delighted. So this is a step-by-step guide that I always try to use and try to follow. For every case, starts with the examination of the dog, of course, and then ends with the use of 3D guides intraoperatively by the surgeon. But the crucial starting of the step for a 3D printing or CAD specialist is the segmenting. So we take out the images and then design, produce, post-process, testing. And I think the most crucial step in this image is the testing step, because here we can see, and if we need to go back, then we redesign them and then go back and go around here. But that's a really crucial step here. And yes, so do I think that we can use 3D for other purposes than surgery? Yes, I think there are a lot of fields that we can use it, and these are all examples, a few examples that I've been using it. The bottom middle image shows a dog with double aorta. So both the right aorta and the left aorta where the right aorta was persistent in this dog, and we had to close it or do the surgical correction. But it was so much easier to see on this image how the actual anatomy looked like. So it can make it easier for a surgeon to see before going into the surgical theater. And the upper images too here is a 82-year-old old Greek tortoise, which suffer of right shoulder pain. And here you can see the left shoulder, and the right shoulder looks really severely changed. So it had osteoarthritis, and it was put to sleep because of that. But it let us understand that to see the actual disease in a different way. And this is a bronchoscopy model where you can use with endoscopic exams to go down to trachea and the bronchi, just to train younger colleagues to use these techniques. This is a dog with transparent skin, so you can see the arteries. And here you can see abdominal vessels to practice and to get a better understanding how different vascular systems look like and how they can, and we can compare it to diseased dogs. Yes, so that's what I had to say. And I'm more delighted to, if you have any questions or comments, please send me an email or fill in a form on my website. Yes.
All right, great. Thanks, Alexander. That was wonderful. Do we want to do some questions right now, Jenny, or wait till the end?
Yeah, go ahead and go with the questions. If anyone has questions or you have any questions, please put in the QA box, guys, if you have any questions.
Okay, one question was, what was the material with Harry? What was the material that was printed and sterilized? And I guess it's kind of a two-part question they had. How do you find materials to be used for implants or for your surgery?
I mainly use Formlabs machine. So they have specialized materials that they have full biocompatibility on, that they have ISO certifications to be used intra or in bone contact, bone soft tissue, but that's a technique used with SLA. So that's the main material that I use.
Okay, and that's the Formlabs behind you on your left?
Exactly, it is. Okay. Yeah. And they actually have a new white material that is even more biocompatible. So they released it this year, which I also use right now.
All right, great. Well, good. Do we have any other questions at this time, or we'll follow up at the end with more?
Yeah, now let's go move on to the next speaker. Hey guys, please put your QA in the box so that we can keep track. Later on, we're going to have more question sessions so your questions can be answered. Okay.
Okay, I think we're going to start next with Andrew Alishorn. Andrew, do you want to share your screen? And
right, I'm actually going to just show you some photographs and talk about what I did. Because it's a bit more interesting. So my background is I've been in the industry for 30 years, got involved with 3D printing when it first came out. I'm not a vet, but I specialize in applications and solving problems using this process. And it can be anything from SLS to SLA, like Alexander just mentioned. Yeah, I know which materials we can use for different things, and that's why I can sort of help people and solve the problems. So I'll see if I can share my screen. Where is that on this one? I'm not used to this. Oh, there you go. Right, can everybody see that?
yes.
Yeah.
Okay, so I can't see the pictures now. Great. So basically, Frida is a 15-year-old Clydesdale horse, and the lady that is next to her there is called Anne. She bought the horse not knowing that Frida had a disease called canker, which is basically, I think most of you guys will know, it's a debilitating disease. It's a fungal growth in the horse's foot, causes the horse to be lame, and then basically, the horse has to be shot. So they spent in dollars about $6,000 with vet bills to try and solve this problem. So what I did is I sat down with the owner, the farrier, the vet, and I said, right, what causes this problem? And basically, moisture gets into the foot and it creates this fungal growth, and it basically eats away at the foot. So I'm trying to just get you the next picture. There you go. So that's basically the canker. Yeah. So a normal horse's foot doesn't have that in there. It's like I suppose a fungal nail growth in the equivalent of a person. They tried taking this out, and then they said to me, we take this mold out, we put the chemicals inside it, we put a dental sort of epoxy in there to hold it in, and then they just wrapped the horse's foot in duct tape. And what happened is when the horse is walking around again, moisture gets inside, and basically it just starts to grow again. So it's a vicious circle. So my first idea for this was to make some sort of casing or shoe that goes on the foot. And I discussed about using silica gel. So for people that aren't sure what that is, it's the same stuff that goes into a baby's nappy. So it soaks up a lot of moisture. And it's also used in the lasers on the 3D printers that I use. Yeah, they put silica gel in the laser head to keep moisture out of the laser head. And they have a special one which changes color when it gets wet. So my idea, first of all, was to actually put this silica gel in. When it changes color, you know it's taken the moisture out. And we could make like a little cartridge that goes in the bottom of the foot once we've installed the plate. And then the owner can just tap the foot and it changes from orange to green. So you know when you need to change it. So you know it's taken all the moisture out and can help keep it dry. So that was one of the first ideas I had. This is basically a full set of from when we started at the top to the end, and I'll just go through the slides and show you what we did. So we started on the 8th of November, and we found out actually on Christmas Eve